It's a statistic that's astonishing each time I hear it, but the maternal mortality rate, Black mothers, 3 to 4 times more than their white counterparts. How do we begin to address this? And I know it's a complex issue.
It is a huge undertaking, I will say, but it is not different than almost any other problem we look at in healthcare. Is that, frequently we're looking for a one-stop shop answer for these things. And there is not a one-stop shop answer. If we're talking about a neighborhood of folks, and South Dallas is local to us, and a lot of the population coming to Parkland comes from that location, that area is a food desert. And so if nutrition is an important part of, a baby's intrauterine growth, how can they grow well if the food that they're eating is inappropriate and not well balanced? If you think about transportation from that area to get to anywhere is more challenging. And so being able to actually make it to your appointments on a regular basis, in a timely manner is challenged. So if the weather happens to be bad and it's raining outside and you've got other children, bringing your kids to that visit may be a real problem. We look at homelessness and we look at joblessness. Those are the populations that have the highest rates. And it goes on and on and on. That creates this cloud of difficulty. How does police brutality fit into that? It fits into that in a very specific way, is that you create an air of distrust to authority, because when authority is engaged, it becomes a threat rather than a support. And so there's a withdrawal from many of the areas where that help could be rendered, but the impression is that I don't know how that's going to be received. I'm not sure what that brings to me. Maybe I should avoid that. Mm-hmm. And the big looming characteristic is that in recent days, I'm teaching a course and we're looking at specifically social determinants of health, and we spent some time in the county jail. The county jail of Dallas is overrun with men of color. And if you look back historically at how is it that a jail in a county that is only 13 or 14% Black can have, nearly 60 or 70% of the males there are Black. We've set the jail system up to be another system of Jim Crow, unfortunately, and there's a great book about that. But we've set that up, and so that destroys the family, it destroys the fabric, it destroys the confidence. It sets up a long history of failure and disenfranchisement. Those things are all not biological, but they tie directly into the biological factors that contribute to a healthy mom and a healthy baby and a healthy relationship that present to Dr. Rogers for her to take care of them. And so when they present to her, they're carrying the weight of the world. And, it's very hard for their care provider to overcome all those things in one answer. Mm-hmm. So I think that to come back to your real question to me is that I think, we need to understand where are these people coming from? What are the issues that they are specifically facing? We know the area, the general neighborhood and what that looks like and what the needs are. But for you one patient that I am taking care of, what is your greatest need and how can I help you to overcome that need? Whether that be the social worker that understands very well how to get proper food, can help them with some of the other things of their lives that really make a difference. I think that from a doctor's perspective is where we have to start going. At healthcare systems like in ours, we have now a social determinants of health wheel that is on the patient's record. And when the patient presents, all of those questions will tell you, where is the greatest need? And so looking at that wheel can be helpful for the individual provider to say, I need to talk to them about nutrition, or I need to talk to them about transportation, because that's what the biggest piece of their wheel that's deficient in how they present to you.
Yes, and I'm nodding like I am because real quick, I don't want to, Dr. Rogers is going to take her part, but I went to graduate school in Oklahoma, at the University of Oklahoma. And what was staggering there, and we started doing more studies on it and looking into it, was the number of women incarcerated for nonviolent offenses within that state. And then if you broke it down even more, to the women of color, and then the number of children that ended up in the foster care system.
Yeah.
And then all of those things that happen as a result of that. So anyway, don't want to get off course too much, but Dr. Rogers.
What was that book called that you mentioned that there was a book on that? What was the title?
The New Jim Crow.
The New Jim Crow.
By Michelle Alexander. It's a very good book. Actually, it was published 10 years ago, and it's republished in 2020, and it also has a workshop book that is accompanying it.
Okay,
thank you. Dr. Rogers, did you want to give your take on?
Yeah, it's such a multifactorial issue, and I think what we as providers are tasked to do is to identify the issues that are impacting our outcomes, and then try to resolve those issues. And so in Dallas, at our public hospital, we have a prenatal care system that involves clinics that are spread very strategically around the city to serve populations so that may have more difficulty accessing care at the main hospital, so that transportation is less of an issue. It's a little bit, they're smaller, they're more intimate. We ideally have these clinics serve not only just the pregnant woman, but they do well women care, contraception. Sometimes pediatricians will be there so they can take care of the whole family. And so I think access to care is a huge part. And I think you have to really know what the challenges are to your patients accessing care, and who's going to access care if there's distrust. So it's taking the time and building relationships with your patients, which I think in medicine is getting increasingly difficult because of time constraints and documentation and all the things that we know. But until you've built that relationship, you have to understand that you'll have a group of patients that will come to you with a higher level of distrust than perhaps you as an individual have earned, but it is your obligation as their physician to work past that. And you do that, by getting to know your patient and asking questions. And if a treatment plan isn't going the way you hoped it would go, to really try to drill down to what the real problem is for that individual, whether it be an issue of compliance or what have you. You can't assume you know the answers to those things. You really have to ask.
And now COVID has probably complicated everything beyond anything we can imagine. That, we hear Dr. Spong, her side of it here and there, but, that's exposing more of these disparities.
It's hard on so many levels. We are relying more on telehealth, which has its place, provided your patient, again, has access to a phone, has access to internet, and so forth. So it can be helpful on the transportation side, but you also have to make sure that you're not just substituting one challenge for another, right? If they don't have access to Wi-Fi. It's the humanistic side of medicine. You're wearing all these masks and gowns and things, and I think it makes it harder, right, to connect to your patients under all of that equipment. And it's, maintaining distance. And I think too, when you have people who are nervous and perhaps frightened of the healthcare system, and then you ask them to come in with no visitors, right? Because we've limited visitors in the hope of flattening the curve. And then you ask them to go it alone, and some patients, you know, the fear of that actually prevents them from accessing care.
Okay. Dr. Nesbitt, is there anything you'd like to add? Any final before we wrap up?
Yeah, I think on the subject of COVID is that COVID and the recent reprisal of police brutality and the protests has created a very caustic situation in terms of healthcare for communities of color. That there are so many levels of the issues that come together in a really terrible way that leads to improper and insufficient care because of fear. And you know, I think the distance between coming to an office if you're worried about catching a disease, but if you're also worried about getting there safely or being stopped by the police and not surviving, it creates a whole nother air of difficulty, and people who should come will not come because of fear for multiple reasons and sit at home for all kinds of disease issues. They just won't show up and thinking that it's dangerous for them to be there, and that puts another burden on the healthcare system and the provider is to really reach out. And I agree with Dr. Rogers with respect to doing telehealth visits is that it's challenging. It is very tough for communities of color to get completely on board with it because quite honestly, like everything else, the systems in their neighborhoods are insufficient. They're not prepared for this. And it's hard to get them to feel comfortable with it. I've done a lot of phone visits as well as virtual visits. And, you know, I think the other part of it is time. It's being able to give a little more time to people and a little more kindness. This is simple things. It's just like being in a grocery store where you have a mask on and everybody's working hard there. I have found that in these days, smiling and greeting them makes everybody feel a little bit more comfortable. Similarly, in the healthcare environment, when you're challenged the way we're challenged, is to remember that these are human beings that we're taking care of and that we intend for them to feel that comfort level, that nurturing that we're here to provide. Whatever that means for them, we need to be sensitive to giving that back to them in the patient care arena. And I think that that should fuel us to become much more sensitive to all of their needs overall. We're vulnerable right now.